On January 30th, the World Health Organization said the COVID-19 pandemic still constitutes a public health emergency of international concern. The view is that it's at a transition point. What does the transition point mean? I'm joined by Charles Ng, a medical doctor who holds a master's degree in public health from the Johns Hopkins University. He led the COVID-19 initiative and published the digital solutions for COVID-19 response for the Bill and Melinda Gates Foundation. How do you interpret WHO's characterization of the COVID-19 pandemic being in transition?
In most of the richer countries, the pandemic has entered a plateau stage. Death rates, hospitalization rates have all declined to levels only slightly higher than influenza compared with original strains. But that's not the case in Africa and much of the developing world. Shaky health infrastructure, undertrained healthcare workers, gear shortages, oxygen shortages beset their people. Not to mention, even in a developed world, vaccination rates are at an average of only around 70%. Vaccine access still remains an issue, especially in its suburban and rural areas. That's not the case only in China, but also across the world. And mind you, in China, the vaccination rate is actually pretty high compared with most of the other richer countries. So it is against this backdrop that the WHO has to show signs of resilience. PHEIC is just a warning that no one should take comfort in the midst of the uncertain perils brought about by an ever-mutating virus. Vaccine hesitancy, health misinformation remain as top priorities. You can see even monkeypox is still labeled as PHEIC. Compared to that, COVID represents a much greater and broader public health challenge on a global scale. Cancelling PHEIC at this stage may be seen by developing countries as being irresponsible, since they have yet to catch up. So transition phase is also a signal that WHO realizes while many parts of the world are pivoting, and that leading scientists also agree that SARS-CoV-2 is here to stay for good. In short, PHEIC cannot remain forever, but in terms of the current public health crisis, more needs to be done before world leaders can sit back and relax.
As we've seen from China's Spring Festival holiday travels, the more than 226 million passenger trips didn't cause a spike in infectious cases. How would you assess China's COVID-19 response at this moment?
Yeah, China has actually done pretty well against other countries' predictions. Now, just take a look back at COVID. XBB 1.5, the newest predominant strain, originated from New York. There's no evidence that China is exporting novel mutated strains. Vaccination rates, as I mentioned, are also a lot higher in China than America. As much as a minority of countries criticize China's homegrown vaccine, evidence has already shown it helps reduce mortality and morbidity when infected by the virus. So science and numbers speak for themselves. As I see now, travel restrictions against mainland Chinese tourists look more like discrimination and political stunts. It's completely illogical, it's against the diplomatic norms, and absolutely bonkers. What surprises most people is that the leaders who erected these restrictions represent the countries that often say they have the most advanced science. Such a shame.
What more should be done for the world to get through this transition? We've seen China beefing up protections for the vulnerable population since its policy change. How could the international community strengthen its cooperation in this last stretch of the pandemic?
I'll repeat this message again and again in all the medias, when I write articles. Get those jabs. So cities are doing pretty good. It's the villages and rural areas that need the most help accessing vaccine and drugs. We don't want those farther off from the city centers to feel left behind, because such was the sentiment that gave rise to populism in America and Britain. But the mantra, leave no one behind. In fact, this was the exact mantra of the Chinese central government when it chose to enact tighter pandemic policies in the last 2 to 3 years. To the international community, I would urge countries and scientists to share research, data, and learnings. Even in the post-COVID area, it proves wise to improve emergency preparedness